One of the most important things you can do in picking the right hearing device is not picking the device itself. One of the most important things you can do is pick a provider of that device that gets it, that gets you, and can help bring out of you what your needs are. Not everyone needs the most expensive hearing devices out there. In fact, most people don't. But everyone has a unique set of needs, environments, and challenges that come along with communicating through a hearing loss. You need to first pick somebody who is highly educated in the field of helping people with hearing loss. There are three basic professions that get involved with hearing loss. There are medical doctors, ear, nose, and throat physicians. Typically, medical doctors will help with hearing losses that respond well to medication or surgery. We absolutely need ear, nose, and throat physicians because there are a number of disorders that they can help with. But at any given time, the Better Hearing Institute in Washington, D.C. has determined that only about 10% of hearing losses are going to respond well to treatment through medication or surgery. The other 90% of hearing losses will need a different type of treatment, typically hearing devices. When you go in and talk about hearing devices, you're typically going to talk to either an audiologist or a hearing instrument specialist, a hearing aid dealer. Now, every state is different, so I'm going to talk about my home state of Oregon. The audiologist is required, if they're coming into the field these days, to have a doctorate, either a PhD or a degree called an AUD, which is Doctor of Audiology. They're required to have a good 8 years of college under their belt to be able to see you clinically. In the state of Oregon, a hearing aid dealer is not required to have any college-level coursework at all. There's a big difference in the training model. The hearing instrument specialists in Oregon do have sort of an apprenticeship program that's a relatively short-term program where they have to pass some tests at the end of it, but it's nowhere near the level of training that an audiologist goes through. There are some great hearing aid dealers in Oregon, but it's more a function of whether that hearing aid dealer has really taken their profession seriously and gone above and beyond to be able to be the best at their job that they can be. With an audiologist, you come to the table knowing that that audiologist has a huge body of education and knowledge behind them before they ever put the earphones on you. Once you've selected the type of professional you want to go to, it's important then to make sure that they understand that the audiologist is here for you, that you know your experience, you know what you need, you know how the hearing loss is affecting you. The audiologist needs to talk with you about what you want to achieve. Do you want to achieve better hearing in work meetings? Is your primary issue better hearing in one-on-one conversation? Background noise situation, like a restaurant. All of these different environments may make one hearing device more effective for you than the other. Maybe you've had a bad experience with hearing devices elsewhere. Maybe they squealed all the time. Maybe they made your voice sound like you had a bad head cold. All of these issues are addressable with the right hearing device. So your audiologist should sit down with you and do a needs assessment. Basically, they should talk to you and listen to what you say. If you feel like you're not getting that from your provider, it's time to choose a different provider.